Hi, my name is Heather Ramos, and I will be performing the ophthalmic medication administration skills video today. I'm in my school uniform, with my school badge. I have no artificial nails or nail polish. Before I begin, I'd like to do a quick room scan so you can see my environment. Just unplug my laptop. Okay, so in front of me is my desk, and I will be working on my station here has my mannequin and my supplies. Plug it back in. All right, so the first thing that I'm going to do is verify the physician's orders in the patient's MAR. I'm going to verify using the six medication rights of administration, which is right patient, right medication, right dose, right route, right time, and right documentation. I'm going to check the medication against the physician orders, and this is going to be the first check of 3 checks that I would perform before administering any medication to a patient. So today the physician has ordered timolol 0.25% solution, 3.4 milligrams per ml, and the orders read instill 1 drop in each eye twice a day, in each affected eye twice a day. So enter patient's room, close door for patient privacy, and then perform hand hygiene. Hi, my name's Heather, and I'm going to be your nurse today. Can you please tell me your first and last name and your date of birth? Check against patient's wristband and verify 2 patient identifiers. All right, thank you, Mr. Smith. Do you have any medication allergies, food allergies, or seasonal allergies? You don't. Okay. So I'm going to check the medication. This will be my second check. Check the medication against the physician's orders and look in the MAR. I'm also going to confirm that the patient does not have any allergies as previously stated. He does not. All right, Mr. Smith. Your doctor has ordered some ophthalmic medication, eye medication, to be administered to you. Okay, it's called timolol, and it's a medication to help treat your glaucoma. It's a beta blocker that works to reduce the intraocular pressure in your eyes to help alleviate the glaucoma. Doctor has ordered for me to enter 1 drop in each eye twice a day. When I do administer this, there may be a slight sting or burning sensation that you may experience. Please try not to blink when I administer it, because if you do, we'll have to start the procedure over again, just because the medication may not have gotten into your eye. We don't want that. Some common side effects would be sensitivity to light, headache. Okay, some less common side effects are called adverse effects. Now, if you experience any of these symptoms, please notify me, hit the call light, and I'll come in and assess you. This would be if you experience any chest pain or pressure, tightness, okay, shortness of breath, or facial swelling. Please let me know. Hit the call light, I'll come in, I'll assess you, and I'll also notify the provider. But again, these are less common and they should not occur. Now, before I begin, do you have any questions for me or about the medication? No? Okay. I'm going to perform my last check of the medication against the physician's orders before I administer. Okay, so first thing we're going to do is we're going to clean your eyes. I want to make sure that there's no crust or drainage because we want to make sure that the medication gets directly in your eyes. Okay, so I'm going to lay you back, supine position, or laying flat on your back. Okay, what I want you to do is just have your head slightly extended for me. When I administer the medication, I'm going to let you know to tilt your head and look up. Okay, first thing, I'm going to perform hand hygiene, and then I'm going to get some clean gloves on. All right, Mr. Smith, let's get you on, laying on your back and in a comfortable position, okay? I'm going to raise the bed to a nice working height, lower the bed rails, and then lay the patient flat on your back. All right, so I have a washcloth here and I would use warm water. If I noticed any drainage or any crusting around the eye, I would take my warm washcloth and gently hold against the eye, avoiding putting any pressure on the eye. And I would hold here for several minutes to help break up that debris. I'm going to take my washcloth now and sweep from the inner canthus to the outer canthus, like so. Now I'm going to alternate, and I'll hold. This would be for several minutes, but in this case, I'm going to speed it up and sweep from the inner canthus to the outer canthus. All right, how you doing, Mr. Smith? All right, cool. I'm going to go ahead and throw this away. I'm also going to take off these gloves and perform hand hygiene. All right, Mr. Smith, we're halfway there. I'm going to go ahead and get the medication in your eyes now, okay? So after I perform hand hygiene, I'm going to get some clean gloves on. I have some tissue here that I'm going to use. Mr. Smith, I'm going to be touching your face, okay? So I'm going to be pressing on your cheekbone. I have some clean tissue here that I'm going to use in my non-dominant hand, and I'm going to apply some slight pressure on the cheekbone and pull down to expose the conjunctival sac or the lower lid. Okay, I'm going to have you tilt up with my dominant hand, gently place on patient's forehead. Go ahead, look up for me, and 1 to 2 centimeters away from the conjunctival sac, I'm going to instill 1 drop. Doing great. Okay, now with another clean tissue, to avoid any systemic effects, I'm going to gently press on the nasal lacrimal duct here, and I would hold for pressure for 30 to 60 seconds, but in this instance, I'm not going to hold it for that long. Okay, I'm going to toss this one. Same fashion, I'm going to get a clean tissue with my non-dominant hand, using my thumb and forefinger. I'm going to gently pull down, exposing the conjunctival sac here. With my dominant hand, gently place on patient's forehead, 1 to 2 centimeters away. Keep moving. You can't do that. And then press 1 drop, and still 1 drop. Okay, go ahead and toss. And then I'm going to take another clean tissue here, and then again, gently press in the nasal lacrimal duct for 30 to 60 seconds to avoid any systemic effects. Okay, thank you for looking up. Now go ahead and not blinking. Go ahead and now blink for me. Good. All right, how are you feeling? All right, let me go ahead and take these off. I'm going to perform hand hygiene. Let's get you back up to a nice position so you're not laying flat on your back. So I'm going to lower the bed. I'm going to raise the rails back up, get patient nice and comfortable. Mr. Smith, do you need anything before I go? Okay. Now again, just to reiterate, if you experience any of those adverse effects that we discussed earlier, chest pain, pressure, tightness, shortness of breath, or facial swelling, hit that call light button. I'll come back in, okay? I'll be back to round on you in a little bit. Okay, so I'm going to document that I administered this medication to the patient. I'm going to perform hand hygiene one more time before I leave and then exit the patient's room.